on Monday, a new dental practice opened in Bristol. And what happened was that hundreds and hundreds of people turned up to register as patients. Anyone who knows anything about dentistry in the UK at the moment will know that it is in a pretty dire state. So dentist surgeries in the UK, despite the fact that we have a National Health Service, which is a publicly funded health service, which is for most things free at the point of use. Prescriptions are a little bit different in England. Even that is sort of capped. So you pay, it's like a set fee of £9.75, I want to say. However, various bits of the NHS are private. You also, even if you have an NHS dentist, you do have to pay. But in theory, it's subsidised at least. So I think there's 3 tiers, is that right? Yeah, 3 bands, £25.80, £70.70 or £306.80. And basically those are bands based on what treatment you need. If you go in and just have a checkup, then you'll pay £25.80. And then on the back end, the government, in theory at least, we'll come to this, sort of tops that up to pay for the fact that it costs the dentist more than that. Dentistry in the UK, even if you see an NHS dentist, is run by a private business, right? This is the same with GP surgeries as well. So all doctors, general practitioners, what Americans call family doctors, the doctor that you'll go and see if you go, oh, I'm feeling unwell and I don't need to go to hospital, but I would like to talk to someone about X, Y, and Z. Those are all private businesses that essentially get money for providing you with care. So it's still paid for by the government, but it is delivered by people who are not directly employed by the NHS. And so it works the same with dentistry, wherein, if you go to your dentist and just have a checkup, you'll pay £25.80, and, you're paying that to this private little business, which will be run by somewhere between 2 and 6 dentists, I imagine. I've never seen a dental practice with more than 6 dentists, I don't think. And if you just have a checkup, then £25.80, in and out, you're done. If you need something a little bit extra, so maybe you need a filling or 2, then that'll be £70.70. Also covers a root canal, apparently, which is expensive, private. Band 3, so if you need dentures, bridges, crowns, all of this stuff is exorbitantly expensive if you have it privately. That will cost you £306.80. And so it sort of gives you this system where you know what the options that you're likely to pay are going in, and also it is subsidised. Even if you have a 15-minute checkup with an NHS dentist, it costs that dental practice a lot more than £25.80 to do that. I would imagine that even the dentist's time probably costs more than that. But also, a lot of the stuff they're doing involves kind of stuff that is consumable, stuff that has to be thrown away, or stuff that has to be sterilised. There'll be a dental nurse in there as well. And, it's a building that will need to be paid for in some way. There'll be receptionists, all of that. There's no way that your 15-minute dentist appointment actually costs as little as £25.80. What's happened in recent years is that the amount of funding that the government gives to the dental practices on the other end, theoretically, to top this £25.80 up to the amount that it actually costs the dental practice to provide that thing, no longer really covers that. And so essentially what's happened is that a lot of the dentists in the UK have decided to just become private dentists. As I mentioned a moment ago, because dentistry in the UK is run by private businesses, lots of them for a long time have offered some NHS spots and some private spots. And that has meant that if you pay to go privately, it will cost you more, but you might not have to wait as long for an appointment because there might be more private slots in the day than there is NHS slots. Often they can use different stuff. So by virtue of providing care on the NHS, they will have limits as to what they can use for certain things. So they might only be allowed to use certain anaesthetics or only allowed to use certain tools. Essentially what's ended up happening is the amount of money that NHS dentists get, which is intended to top these amounts up to cover the actual cost of what it costs to actually kind of deliver these things, no longer meets the cost of doing it. What they've ended up doing is just gradually phased out the number of NHS slots that they offer until at some point, a lot of practices have now just become private practices completely. But yeah, the waiting list for dentists near me is about 7 years, I think it was, last time I looked this up. I mean, it's just a example of just kind of systems collapse. The root cause at one point was there not being enough money, but now you don't have the staff to do it anyway, and you end up with all these other challenges as well. I mean, the whole system of both dentists and GPs being largely small, but still kind of private companies that are essentially contracted by the government to run NHS services is kind of odd and unnecessarily complicated. Most dentists, I think at least, are still like one practice of 3 dentists that do their thing. What's started to happen with GP practices is more and more kind of chainifying of that, where you might get 5 doctors' surgeries that are all part of the same clinical group. I think it's taken quite a lot, both the relative lack of funding from the government, but also their lack of desire to fix it, and the kind of insult that I think a lot of dentists feel from that has been quite extreme. Like, I think it is, for them to get to this position where so many dentists who otherwise might have done NHS work are going, no, I'm just going to do private work now, is quite a place to be. I think most people who work in some kind of healthcare role are very much driven by a desire to do good things for their community, to provide healthcare for people that need it, and are willing to accept less than ideal conditions and pay in order to do that. Private work is kind of stigmatized a little bit. Maybe not amongst everyone, but amongst a lot of people, even people who do it, like there's a bit of a, oh, this is going to the dark side kind of thing. Whereas what's happened with dentistry is the situation is just so bad that people don't even, I don't know, I'm sure they do feel bad about it, but it's at least push people to feel able to do that, and that's a really sad place to be in.